welcome to the Oncology Summit 2025. So, according to you, how do you see the integration of mental health, nutrition, and survivor counseling influencing cancer treatment outcomes among the Indian patients?
Well, this is a very valid point, and actually, I think cancer that's becoming like an epidemic in India, and it's high time that even as doctors, we look at all aspects of cancer, not just from the treatment point of view, be it medical, surgical, or radiation, but looking into the nutritional aspects, the mental well-being, and even the social outlook of how the patient or his or her family would be reacting to it. So, as healthcare professionals, I think it's high time that we talk about these aspects, take the patient and his or her family into that entire confidence loop and discuss all these aspects, because that is what we will be eventually giving a quality care to these patients if we take all these factors into account.
How do you see the collaboration happening, and how necessary do you feel it is between the clinicians, doctors, psychologists, and support groups and everything? How do you see the collaboration happening, and how important it is?
Yeah. So it's again, as I told, oncology, the cancer is spreading like anything. So are the treatment options. Now started when the oncology care started, there were only a few limited options. Even while I was doing my MBBS, I used to remember any cancer patient who used to come, and our professor would used to say कि बाबा या माता जी आप घर चले जाइए या घर में बच्चों को आप इनकी सेवा कर लीजिए. We have moved much ahead from that time, where now people with cancer, we talk about cancer survivors, they are living beyond 5 or 10 years. So that is how medical science has advanced. Newer therapies have come into being. So it is all the more pertinent that all these therapies are kind of holistically, uh, all the clinicians sit together and discuss what's best for the patient. I'm an interventional radiologist, and to be honest, interventional oncology is now being fast recognized as a fourth pillar of oncology care. So traditionally, you would have known about the medicine, the surgery, or the radiotherapy, but people don't know about interventional oncology. But this has really transformed how these patients who didn't have any hope previously are now being treated. So it is very important that this collaboration happens right at the beginning of the treatment rather than towards the end of the treatment, because that is when we will be able to give the best quality care to these patients.
What, according to you, is the next wave that is coming in the terms of cancer hospitals, cancer treatment, in terms of infra, technology? What all is coming up?
So it's coming a big way, because as we see the numbers are increasing, and people are also accepting cancer not just as I would say a dreaded disease, but now more of a lifestyle disease, because it's like diabetes. Like with diabetes, you have treatment for your entire life. That is what people are also accepting, that with cancer you can go on and continue with the treatment. So once that happens, that acceptance comes into the society. We don't look cancer patients with a stigma, and these patients are also more confident. So I think more and more healthcare facilities, more hospitals, more dedicated facilities are coming up, more dedicated oncologists are coming up. So I think I would say gone are those days when cancer patients would need to be feeling afraid, or would feel that there is no option for them. I think medical science has evolved so much. I think we can really offer a good healthy life to these patients as well.
Thank you so much for talking
Thank
with
you.
us. It was
Yeah.
lovely talking.